So I am here with Dr. Lee Berk. This is Frank Chindamo. I'm here with Dr. Lee Berk, and as you can see, he's got a few certificates on the wall, in addition to, as you can see here, TV Land. How did you get that from TV Land?
It was sent by Nick, whatever his name is, I don't know if he's the owner or whatever he is of TV Land.
And you've been in.
He's been here. We talked together a number of years ago.
And just this week, you've spoken with folks at Oprah's magazine.
Well, we interview. I do constant media interviews. Oprah magazine this week, Red Book this morning, and it's just constant because they're interested in humor. They want the evidence, the scientific evidence. They want to know why humor is important to an individual and to the readership, and what is the value.
And so you believe that humor and health are connected?
You're preaching to the choir here again. Humor and health are connected. There's the old wisdom of the Bible. Merry heart does good like a medicine, but a broken spirit will drieth the bone. That's in the Bible. Okay, well, the Bible is as modern medicine as you can get relative to the mind-body connection. And the reality of, indeed, the ancient Greeks used to build their healing temples beside the amphitheaters so that the sick could be entertained.
Wow.
Which would change their mindset, and they noticed that they would, a good percentage of them would get well sooner.
And so what we're going to hopefully do together is we're going to take that amphitheater and put it onto the television sets and provide some comedy.
What you've modernized with the web and television and the current technologies can be applied to the healthcare setting, and we need to pursue that to see what the potential outcomes may be, both scientifically, medically, and monetarily.
So ultimately, and this is my last question, ultimately, do you believe that if LaughMD were to be installed in a hospital system, that we could come up with demonstrable, measurable findings that show that not only is laughter good medicine, but that laughter in a hospital is good medicine, and that it can save hospitals money and make patients feel better?
I think it's important to document and produce evidence base for any type of intervention. If indeed the patient is watching humor or some other type of intervention, just as a medication, what is the outcome of the medication? Humor watching is indeed a behavioral medication. And then what is the consequence or the benefit thereof? And that needs to be measured and quantified so that you can provide evidence base for that, and then you can make your product much more sellable.
And this is not something that's surprising. This is something that we know to be true in our hearts anyway.
Sure. Yeah, this is intuitive, and indeed, but again, the world of healthcare and medicine is evidence-based. So what is the evidence for the value to both the hospital and the patient for doing this meaning providing them with humor, if you please, therapy.
Fantastic. All right. And one last question. The studies that you were doing today in the lab, they were taking humor. Yeah. What were the three types of videos?
The current studies that we're doing is an offshoot of a study that we presented at a scientific meeting at the American Physiology Society meetings in San Diego, California. The meetings are entitled the FACET meetings, the Federation of American Societies of Experimental Biology, hugely attended in the range of 25,000 to 30,000 people from all over the world. What we documented and showed indeed that humor indeed resides in the brain relative to the same area that positive emotions do, and we're documenting. We documented that it exists in the preliminary research in what we call the left frontal area, the F3 area, and that's synonymous with positive affect or positive emotion. In split brain theory, the right side, F4, is associated with negative emotion or depression. And so humor indeed is documented in the brain, if you please, with EEG, electroencephalograph, as a positive emotion.
There we go. Thank you very much, Doctor.